How's it going, guys? So today we're going to talk about discovery visits. So discovery visits are essential to cash pay physical therapy because it helps establish your relationship with your client and it's your first encounter with the client. So when I do a discovery visit, it's usually a free session, anywhere between 15 to 30 minutes, and the whole purpose of the session is to see if we're actually able to help our prospective client. Most of the time it's yes, but sometimes we can't help them. In that case, we try to figure out what is the best avenue for their health, whether they need to see a surgeon or some other sort of specialist. So that's the main goal. And within the discovery visit, if it is something that you can help with, then you have a couple other goals. You have to figure out how to connect with the client. It's very important to connect emotionally with a client and communicate the value of your services and make them feel better by the time they walk out of your clinic. So if the discovery visit goes successfully, then the next step in the process is initial evaluation, where you actually come up with a plan of care. But in this case, we're just going to do 15 to 30 minutes to just see what's going on and see how we can help this person. So here I have Josue. He's one of my best friends. We've been friends for multiple years, and he's actually been dealing with hip and lower back pain since I've ever met him. And I've never treated him, but recently his hip and back pain has gotten worse. So he reached out to me to see if I could help him out. So we talked a little bit about his what's going on, but I'm going to have him tell you guys what he's been dealing with, what he's gone through, what specialists he's seen, and you guys can see what he's dealing with. You guys can come up with your own clinical thought process, and then I'm going to run you through what I'm doing, what I'm thinking, and I'm going to show you how I would treat Josue if he was a client within my clinic.
Yeah, so basically what I've been dealing with, like I mentioned before, is, I was diagnosed with femoral acetabular impingement, FAI, after I used to powerlift and squat frequently about 5 times a week for about, a year or two. And I went to see a doctor. They mentioned, he was a surgeon. He mentioned that I would have to get laparoscopic surgery on my left hip to fix it. And I wouldn't be able to squat and powerlift, et cetera, et cetera. Additionally, I've also been suffering like lower back issues on my right side. It tends to flare up every now and again. I had that at around the same time the hip injury started. My mom historically has had a bad back, and I always thought of myself as one who had a bad back. But recently, I've gained some weight because I haven't been able to lift weights as much anymore. Running at a point actually started to flare it up. And pretty much I want to go back to being active, get my six-pack back, be sexy and whatnot. But I want to be able to do so without pain. So that's like the biggest thing I'm looking for. And I reached out because it has gotten worse. It got to the point where I tried stretching, tried to, kind of Google and figured out myself, and it was not working. So I wanted to reach out to a true expert so I could actually get myself, back to being able to function and do what I want and love to do. So that's kind of like my story in a nutshell.
And what are the things that you really want to get back to doing? Well, like, what are your biggest goals? Because, cash-based physical therapy is a lot of money, and he's paying for these services. This is not free, even though he's my buddy. I am a big believer in patients actually investing in their healthcare, because if I just treat it, even though he's one of my best friends, I don't need his money. However, if he doesn't invest in his health, he's not going to get better. So what is the reason that you're actually seeking out and investing money in your healthcare? What is driving you? What are your goals?
So number one, to be able to get back to lifting weights, pain-free. Number two, to be able to run without pain. And number three, because I'm 27 now. I've been dealing with this since about 22, 23, and seeing how it's been progressively getting worse is making me get really frightened. Because if I want to have kids one day, I don't want to be unable to run with my son or my daughter. I want to be able to, live a life and be healthy and thrive into my retirement years. And at my current trajectory, that's not going to happen because I can't even run anymore. I'm 27 years old. It makes no sense. So yeah, basically, be able to lift weights, be able to run, and be able to not be in pain as I age and be able to, maintain my current quality of life, if not improve it.
Great. Those are all great goals. So just a disclaimer, I've actually never treated Josue before. I have no idea what the root cause of his problem is. So you guys are going to be figuring it out with me. So it's going to be a lot of fun. So let's get into it. So my current thought process, based on his symptoms, he's having hip and lower back issues. My initial thought process is he probably has some sort of pelvic instability where his pelvis is falling in and out of alignment somewhere at the SI joint. Most likely it's due to compensations. I wouldn't be surprised if his core is not firing and if one glute is weaker than the other. So that's the first thing that I'm going to test for. All right, so the first thing I always do with my patients is I take them through the cardinal planes ranges of motion. So first thing, Josue, I want you to reach down and touch your toes. So flexibility is not bad. Any pain or tightness?
Yeah, my hamstrings feel tight. This is not like, I don't feel like, oh my god, this is amazing, but it's not like painful.
It doesn't hurt. So come back up. So flexibility is pretty good. Go backwards.
Like this?
Yep. Any pain there?
I feel some pressure on my lower back.
Right side, left side?
Both. Like
Both?
Yeah.
Right in the middle?
Yeah.
What about side to side?
That feels fine.
Good. All right. So next, we're going to get on the table here. So on your back. So bend both knees. Put both feet together. So next, squeeze against me and don't let me move you. So squeeze your knees together, don't let me move you.
Oh.
Can you feel how I can move you really easily?
Yeah.
So what's going on here? Pelvis is definitely out of alignment. And I'm just testing leg length discrepancy. So yeah, right leg is a little longer than the left leg, but it's mostly likely a pseudo leg length discrepancy. It's not a major leg length discrepancy, very tiny, however enough to elicit symptoms. So what we're gonna do is we're gonna go over a quick muscle energy technique just to get the pelvis back in alignment, and Josue is actually gonna do it himself. So bend up the right knee, bring the left knee all the way to your chest here, without using your arms. Now with your hand, push against your left knee. Don't move it, just match the resistance. And push your right foot through the table. 1, 2, 3, and then you're done. All right, back here. Squeeze together.
What the fuck?
And then push out, push, 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 and squeeze again. Can you feel how that's stronger?
What the fuck?
So, Josue is a big guy. This guy is 6'4", how many, 220 pounds?
Yeah.
My arms should never be stronger than his legs. However, at the beginning of the session, before his pelvis was in alignment, I was easily able to overpower him with my arms. However, now that we got him back in his pelvis back in alignment, let's just check out his legs. So now, leg length discrepancy is gone. So his pelvis is chronically falling out of alignment. What we just did there is a muscle energy technique to get him back in alignment. He's not going to stay in place, so we got to figure out the root cause. Why is Josue chronically falling in and out of alignment? So next, we're going to do some MMTs. So hold it right here. Now, don't let me move you. Don't let me move you, don't let me move you. And that's shit. There's nothing firing there. Let's do it again. So this is Josue's big leg. Hold it right here. 2 fingers. Don't let me move you. Nothing. Like there's no resistance there. Those muscles are not firing. Hold it right here. Don't let me move you. And that's strong. Can you feel how you can actually resist that?
Yeah.
Good. Bend this knee. So now toes back
Like
towards you. Yep. Push your knee down into my fist. Don't let me bounce you. And nothing. There's literally nothing firing here. Like my little fist is able to bounce his entire leg. So that is not good. But he does give us some context. It gives us some context of what's going on in Josue's body and shows us this is a good sign because it shows us there's something muscular going on rather than just FAI, the joint is deteriorated and the only way to fix Josue is for him to get some kind of surgery, a hip replacement, which most likely this isn't a joint issue. It's most likely a muscular issue and the surgeons are missing something. So let's bring this leg up. Allow me to move you. Hold it right here. Don't let me move you. Don't let me move you, Josue. And same thing. Not much going on there. It's a little stronger than the right side. So hold it here. Don't let me move you. And not a lot firing. A little bit stronger than the right side, but not a lot. Hold it right here. Don't let me move you. Internal rotators are much stronger. So external rotators are weak. Internal rotators are strong. Let's bend this side up. Left foot back towards you. Push down into my hand. Don't let me bounce you. And this is strong. Can you feel how I can bounce you here?
Oh, yeah.
So left glute is significantly stronger than the right side. And you were having pain on the left side, correct?
Yeah.
That's where your issues are.
Yeah, left hip, left side, back, right side.
Mm-hmm. So the reason, but the hip gave you more severe problems in terms
Yes.
of it got so bad that you have to go to a surgeon,
Yeah.
correct? So the reason the left hip actually hurts more is because it's his dominant side. The right glute is not doing anything, so the left hip is overcompensating, and this left side is overworked and underpaid. So the real root cause of Josue's issues is actually the right side of his body, the right glute especially, and the right external rotators aren't firing, so it's causing him to overcompensate, which is causing him pain.
Oh shit.
All right. So the next thing that I'll do with my patients is I'll do some myofascial release.
Oh, shit.
So usually, whenever you have any kind of back pain, hip pain, and the glutes aren't doing their job, the quads tend to be really tight. They tend to be bound down. When the quads are tight and they're just the fascia around them are so bound down, it actually makes it harder to activate the glutes. So it really turns into a negative feedback loop. So the glutes aren't doing their job, which is causing the quads to get tighter, and the quads are tight, so it makes it harder to actually activate the glutes. So next we're going to release some myofascial restrictions around the vastus lateralis. That feels good, right?
Ooh.
So he's my buddy, so I'm pushing harder at the get-go than I would on a patient that I didn't have a good relationship with or barely knew. I'd be a lot nicer. But Josue's the big boy, so he can handle it. So what I'm doing here, I'm basically, bring this down. I'm basically just pushing on the vastus lateralis, rolling it over the femur. And would you say this is mild, moderate, or intense?
Now it's mild to if I say I say mild to do it harder. It's mild. It's mild.
Okay, good.
Now we're at the moderate.
Yeah, so you usually want to hang out at moderate. So this will actually, even though it hurts now, it probably feels like almost like good pain, like something's getting released.
Yeah, I didn't know how fucking tight that was.
So we're releasing the quads here.
Oh,
Yeah.
I used to-
There's just a huge knot in here.
I used to foam roll too, so that's crazy that it's
Yeah.
that tight.
Well, the thing about foam rolling, or any kind, so this, what I'm doing is, it is somewhat addressing the root cause, but it's also addressing symptoms. Because if we just do myofascial release, if we just do hands-on work, you'll feel better walking out of here. But if we don't address the root cause and the weaknesses, it's just all going to come back because you're going to keep compensating and you're going to keep making the same mistakes that you've been doing that got you in this place in the first place.
Mm-hmm.
If that makes sense.
Oh, yeah, it does.
So foam rolling is great. However, if you're not doing the proper strengthening, so a lot of people do strengthening, they go to the gym, they do squats, they do deadlifts, and they think they're strong, they think they're doing the right exercises, but if they're not using the right muscles, if they're not using the right form, then it's not actually going to fix their pain, and they're not actually going to be functionally strong. They're just going to be compensating through these different movements and actually flaring themselves up more. So let's check out the left side. So that was the right side. I wouldn't be surprised if the left side's even tighter.
Oh, shit.
Oh yeah. So this left side's like not even moving. So like the right side was tight, but you could actually get some movement there. Left side, just tight, just straight up tight. Yeah, that feels crazy. So during a discovery session, we have limited time. Since I'm explaining over camera, I might go over 30 minutes, but in the clinic, I never go over 30 minutes. So I'd hang out here for a little bit, release some of these myofascial restrictions. This side is just crazy. So, and this is one problem I have with MRIs, because MRIs don't address the fascia at all. Myofascial restrictions don't show up on MRIs. So people see all this scary stuff on MRIs. However, they're not getting a full picture because the MRI showed you had FAI. However, the FAI could have been there for a long time before you started experiencing pain. And we haven't even ruled out the myofascial restrictions, the compensations, the weaknesses. So why would we want to do surgery first when we could first manage it conservatively to see if that fixes it?
So I forgot to mention, I have an old football injury on my right knee. That was the first injury I ever got. So I took a football helmet to my right knee without wearing any pads from practice, and they said that like bummed up my right knee. They said I had patella tracking disorder, and that was the first like injury I ever had. And then from there it was the fucking the FAI and then the lower back. So I guess that makes sense that if my left side's my dominant side because my knee got smashed, maybe I don't know. But I forgot, like it was when you're when you're doing this. I remembered, like, oh yeah, my right knee was banged up. So maybe
that gives us more context. So this is great. This is something you'll get with patients. This is a great example of context you can get with patients as you're working with them, where they first tell you their initial complaints and they're like, oh yeah, I also had this injury. Like Josue had a right knee injury from football, which is probably why his right side is weak now. His right side is weak because of that injury in football, his brain unconsciously is babying that right side, causing him to overcompensate with the left side. So the issues in his hip originate from that right knee injury. So that's a great piece of context. That feels good, right?
It feels something. Oh my god.
We gotta have the song "Hurts So Good" on right now.
Something like that.
So normally, if I was doing a full treatment session, I would hang out on these quads for a while, just because we'll never get optimal glute activation until we release them. However, for the purpose of this video, I'll go on to the next section. So I'm just going to do this next part really quickly, but next in the clinic, I would work on the client's glutes. So roll over on your side.
This side?
Yes, sir. Scoot back towards me just a bit. Perfect. Bottom leg straight. Top leg bent. And I would look into piriformis is usually going to be tight with anybody with hip or lower back pain. How does that feel?
It does feel like tight, yeah.
Yeah. So piriformis, also known as the pain in the butt muscle.
Oh, yikes.
And then next, I would also look into glute med, which right now that's a little bit right here.
Mm-hmm.
But not piriformis was worse, right?
Bad as yeah. Or the quads, goddamn.
The quads were probably the worst. So on a discovery, usually releasing piriformis and glute med, if it's tight, will feel good. So I would spend some time there. For the purposes of this video, I'm not going to bore you guys. So next, go over on your back. So after you do the soft tissue, or after I do the soft tissue, because this is the way I do it. You guys may have your own style, so I'm just sharing what works for me. Bend up both knees. I'm going to reassess the pelvis to see if he's constantly falling in and out of alignment. So squeeze together, don't let me move you, and he's out. Like, try to squeeze as hard as you can. Nothing there. Like, literally nothing. So do you remember that muscle energy technique we did earlier?
Yeah, so this leg as high as possible,
Yeah,
right?
all the way to your end range of motion. So for Josue's here, but you'll get some people that are super flexible, like your dancers, your gymnasts, where they have insane range of motion. So it's really important that this is done at the end range. So for Josue, it's right here. Push with your hand against your left knee. Push your right foot through the table. 1, 2, 3, and relax. Bring that down. Squeeze together.
That's really crazy.
So it's magic. It's a magic trick. So obviously Josue is in place now, but he just fell out of alignment recently. So he's at a point where he's going to be constantly falling in and out of alignment and constantly flaring up. So there's a way to do this technique also in standing. I'm not going to go over that right now, but this is something that this technique in standing, which is more convenient to do. I would have Josue doing that 100 to 150 times per day, because he's going to just be constantly falling out of alignment and flaring himself up until the root cause starts getting addressed and until the muscles start getting stronger. So we've already established that the right side is weaker than the left side. So the first thing I would do for homework is get this right glute to start firing, to start engaging. So keep this left knee bent. So the next part in terms of treating the root cause is to get this right glute to start engaging. So what I'll do is have the left knee bent, right leg straight, Then, with the toes on the right side, have them pointed back towards you, and now push down into my hand. So, nothing here. Like literally this guy is 220 pounds, and I can bounce him easily with my little wrist. My wrist isn't that big. So, we're gonna do it differently. So pull in this core now. So now we're starting to cue the muscle activation. So feel this core, flatten your lower back. Flatten.
Like this?
Yeah, flatten without bending your knee though.
Oh, fuck.
So,
Flatten my lower back?
yeah. Squeeze the right glute and push down into me. Push. Push more. And that's better. Like I can't bounce him now, which I shouldn't be able to bounce him. So now he's using his body more effectively. And relax. So originally, he was getting no core activation, no glute activation, and the quads were trying to do everything. And my arm was able to overpower his quads. Now that he's starting to use his glutes, his pelvis is becoming more stable, and he's actually using more efficient muscles. He's using bigger muscles. So let's try that again. Ankles back on the right side, push down into me. Don't let me bounce you. Hold it.
I should get damn cramp.
Good. Push through the cramp. The reason you're cramping is because you're weak. Hold it. 5, 4, 3, 2, 1, and relax. So where are you feeling that working?
I definitely feel in the glute for sure.
Good.
The glute in my abs for sure, but mainly the glute for sure. Like, damn.
That's perfect. That's where we want them to feel it. Sometimes they're going to feel like they're quad dominant, and they're going to have a hard time to reconnect with their glutes. But for Josue, it was faster, which is good. So let's do it one more time. Hold it. Squeeze the core, squeeze the glutes, push down into me, and so much stronger now. So we're starting, so the muscle is there. It's not that Josue doesn't have glutes. He just hasn't been using them. His brain isn't activating those muscles. And relax. So, obviously, you're not going to have me here all the time, but you're going to have to do this for homework. So the way you do it for homework is, I'm just going to use this blanket, but normally I would recommend a towel roll. Roll up a towel underneath the bottom part of your thigh, toes back, squeeze your core, squeeze your right glute, push down into the towel, and hold it. Really focus on feeling the right glute. Hold it for 15 seconds. So keep holding it, core engage, right glute engage. The muscles are firing so much better now. And one thing that's important in this context for a discovery visit, so you can relax. So one important aspect for a discovery visit is they can actually not feel their, like Josue, the first time you were doing this exercise, you could feel the muscles not firing.
Yeah. I was trying to squeeze my butt and like my glute, I guess, but nothing was happening.
And now you can actually feel the muscles firing. So that's a great way to get buy-in because they're like, I literally am not using these muscles. Oh, now I can actually engage the muscles. Okay, this is, obviously if I can't use my glutes, if I can't activate my core, that's a problem.
Mm-hmm.
So now his strength has already increased in just the aspect of a few minutes. And it's not so much that he got stronger, but he's using his body more effectively, which is going to help with buy-in because they're leaving knowing that they actually improved their strength in a quick period of time. So the last thing that I would do is recheck the pelvis. Oh, and the way I would prescribe that for homework is I would prescribe that 3 times a day minimum, 10 repetitions, 15-second holds. Frequency is going to be your best friend because what you're doing here is you're trying to retrain your brain to start activating those muscles.
So you said, so how long would it be between each rep?
Oh, just a couple seconds.
Okay.
Yep, go through it quickly. All right, squeeze together, and squeeze again, and he's out. So, and also the big thing with the pelvis MET that's important, you're checking for 3 things. Initiations, how is the muscle initiating? You're also looking for strength and endurance. So for Josue, and for anybody with pelvic instability, they're not going to have any kind of initiation. So squeeze together, and it just breaks immediately. So now do the pelvis correction. Keep this straight, or keep this bent. Bring this up to your...
Oh, yeah.
And push against it. 1, 2, 3, and relax. Bring this up, squeeze together, and it's stronger.
That's really crazy.
You can actually, and this pelvis correction is also huge for buy-in because he can feel the difference. He literally has no strength when the pelvis is out of alignment. As soon as he gets the pelvis back in alignment, it's like magic. Squeeze together, and it's strong. He can actually initiate, as he should be, because my arm should not be able to break his legs. So good. So the way I would close the discovery session is I'll tell Josue, we found a lot going on. There's a lot of muscle imbalances. There's a lot of weaknesses. However, this all looks muscular, which is good because it's fixable. So the next step in the process would be an initial evaluation. The initial evaluation is going to be a full hour, and we're going to go through more testing. We're going to go through more treatment. And at the end of the initial evaluation, we're going to talk about your goals, and then we're going to come up with a plan of care together. How does that sound?
Sounds good.